Good day, I am Rebecca Gerdon, your student nurse for today, and for today's discussion, we will talk about fertility issues that is one common problem of the couples or the married couples nowadays. So we will be discussing about infertility and subfertility. So while we are preparing for this discussion, we distributed some papers and you write down the common questions that you want to be answered for this discussion, and we will be answering some of that questions in a little while. So first, we will discuss what is infertility. Okay, so the infertility is the inability to carry a pregnancy to term. So there's a chance that you can get pregnant, but there's a big chance that the baby cannot mature, and or you will give birth to a preterm baby. So what is the cause? What is the main cause of this infertility? So some of the common cause of infertilities are failure to ovulate. So this happened to 40% of women, and not ovulating can be the primary cause of POI and PCOS, or the polycystic ovarian syndrome. So another thing is, what are the diagnostic tests or the evaluation that is being conducted in order to know if someone has infertility? So before we proceed, we have to remember that infertility is not only present in men or in women, but also in men. So the diagnostic procedures are hysterosalpingography, or an X-ray test to outline the internal shape of the uterus and show whether the fallopian tubes are black. Next is ovulation testing, ovarian reserve testing, and ovarian reserve testing. So for the men, some tests are semen test or semen analysis, hormone testing, genetic testing, testicular biopsy, imaging, and other specialty testing. So now we will proceed for the treatment for infertility. So the most common treatment are changing lifestyle. Of course, we have to focus more on healthy diet and other doing some exercise. Next is medications, surgery, sperm retrieval, and for the women, there's stimulating ovulation with fertility drugs, intrauterine insemination, surgery to restore fertility. So that's all for the infertility. So now we will proceed with subfertility. So what's the difference between infertility and subfertility? So the infertility is the inability to carry a term baby, while the subfertility is the reduced fertility or chance of getting pregnant. So the main causes of subfertility are the ovulatory disorders, tubular disease, peritoneal adhesions, endometriones, uterine abnormalities, and abnormalities of sperm and advancing female age. So now for the diagnostic test for the subfertility. So some of the diagnostic tests in order to know if someone has subfertility is mid-luteal phase progesterone assay, a semen analysis, and a test for tubal patency such as hysterosalpingography. And now we will proceed for the treatment. So some of the common treatment for subfertility are the egg donations and the ovulation induction plus IUI or IVF. So that's for today. That's for our discussion for today. So I hope that we have answered your questions, and we have given you a clearer view about this fertility issue.